and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Can aerobic exercise help prevent chemo brain caused by chemotherapy in breast cancer patients? Many women who receive chemotherapy experience a decreased ability to remember, concentrate, and or think, commonly referred to as chemo brain or brain fog, both short and long term. In a recent clinical trial of women initiating chemotherapy for breast cancer, those who simultaneously started an aerobic exercise program self-reported greater improvements in cognitive function and quality of life compared with those receiving standard care. The findings are published by Wiley, a peer-reviewed journal of the American Cancer Society. Genetically tailored diet. Future of diet management in IBS patients. An international study has found that genetic variations in human carbohydrate active enzymes may affect how people with irritable bowel syndrome respond to a carbohydrate-reduced diet. The research, which is published in Clinical Gastroenterology Hepatology, shows that irritable bowel syndrome patients with genetic defects in a carbohydrate digestion had a better response to certain dietary interventions. This could lead to tailored treatments for IBS using genetic markers to predict which patient benefit from specific diets. Nutrigenetics has highlighted how changes in the DNA can affect the way we process food. Now, this pioneering new study suggests that genetic variations in human carbohydrate active enzymes may similarly affect how irritable bowel syndrome patients respond to a carbohydrate-reduced diet. The team has now revealed that individuals with hypomorphic variants in human carbohydrate active enzyme genes are more likely to benefit from a carbohydrate-reduced diet. Can AI help ophthalmologists diagnose corneal infections? Eye care specialists could see artificial intelligence help in diagnosing infectious keratitis, a leading cause of corneal blindness worldwide, as a new study finds that deep learning models showed similar levels of accuracy in identifying infection. In a meta-analysis study published in eClinical Medicine, Dr. Darren Ting from the University of Birmingham conducted a review with a global team of researchers analyzing 35 studies that utilized deep learning models to diagnose infectious keratitis. AI models in the study matched the diagnostic accuracy of ophthalmologists, exhibiting a sensitivity of 89.2% and specificity of 93.2%, compared to ophthalmologists' 82.2% sensitivity and 89.6% specificity. The models in the study had analyzed over 136,000 corneal images combined, and the authors say that the results further demonstrate the potential use of artificial intelligence in clinical settings. Long-term arsenic exposure may be risk factor for cardiovascular disease. Long-term exposure to arsenic in water may increase cardiovascular disease and especially heart disease risk even at exposure levels below the federal regulatory limit, according to a new study at Columbia University Mailman School of Public Health. This is the first study to describe exposure-response relationships at concentrations below the current regulatory limit and substantiates that prolonged exposure to arsenic in water contributes to the development of ischemic heart diseases. The researchers compared the various time windows of exposure, finding that the previous decade of water arsenic exposure up to the time of a cardiovascular disease event contributed to the greater risk. The findings are published in the journal Environmental Health Perspectives. To evaluate the relationship between long-term arsenic exposure from CWS and cardiovascular disease, the researchers used statewide healthcare, administrative, and mortality records collected for the California Teachers Study cohort from enrollment through follow-up, identifying fatal and not fatal cases of ischemic heart disease and cardiovascular disease. Working closely with collaborators at the California Office of Environmental Health Hazard Assessment, the team gathered water arsenic data from CWS for 3 decades, from 1990 to 2020. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.